Living with pain is never easy, and sometimes getting help and not knowing what you're getting into can be unnerving.
And our expert in back and neck pain relief, Dr. Christopher Miller, is making it a whole lot easier. And he's actually having an open house tomorrow that you may be interested in attending. But Dr. Miller, let's start off by talking about those kinds of issues that you really can help people deal with.
Well, we're a last resort for a lot of patients, and the type of conditions that we help treat are the real chronic neck and back pain conditions, which include degenerative disc disease, bulging or herniated discs, sciatica, which is shooting pain down the leg, and they may even have something like that in the arm or hands, and maybe even failed neck or back surgeries. And we tend to use different machines. One is called the DRX 9000, and that's to help with these disc injuries. The other is called Spine Force, and that's a unique piece of rehab equipment that we use in our office. And nothing we do is invasive, so there's never any drugs or surgery involved.
Mm-hmm. Does this season kind of lend itself to people getting into these trouble spots? I know you have a lot of people that come on that have been in car accidents, that happen all year round, but people are more active in the summer than they are typically in other months.
Absolutely, and they have more injuries this time of year, and some people that are just already suffering from these conditions just really have had enough. They see all their friends and family out enjoying life with the nice weather, and they're fed up with it and want to get out and enjoy that as well, so we help all those kind of patients.
And you're actually having an open house, and this one is nice because it's actually, you're opening the doors of your office and your treatment facility for people. Tell us about it.
I think it's a great opportunity for everybody. It's going to be tomorrow night from 3 to 6:30 p.m. and they'll come out into the office. They can check us out, see all these different types of machines that we have for treatments, and there's going to be free food and drinks. I'll be around answering questions. We're doing free massage, free treatments or sessions on the Spine Force machine, so they can come and see with their own eyes that there is a solution for them that does not involve drugs or surgery. And like I said, I'll be out there answering questions as well.
Yeah, free massage. I think you have to have a lot of those chairs lined up because that's nice. Really getting people in, feeling comfortable, asking those questions. I know that you have a lot of patients that have been on 8 West. They've been talking about the different reasons why they ended up going to you and how that treatment has allowed them to really get back to doing the things they wanted to. We're actually going to hear from one of them right now.
Okay, so Chuck, tell me about your trip here to Dr. Christopher Miller. Why are you here, and what kind of relief have you seen?
Well, I had some lower back pain about 2 years ago, and I started coming here about 11 months ago, maybe something like that. And he put me on a regimen, and he's helped my back considerably. I come now just once a month, but the pain has been relieved, so I'm happy.
And it's kind of an interesting story with you two, because your wife had back problems for many years and even had surgery before she started coming here to see Dr. Miller.
Right.
So from your standpoint, is that why you really wanted to get involved here now before you had any additional problems?
Well, her problem goes back a long ways, and she probably should have come here but didn't know about it earlier before her surgery. But once she had the surgery, she couldn't get all of the stuff that he can do here. So I don't think her surgery really had much to do with my decision. I just had some pain in my back and I wanted it corrected. So, and she said, you got to go see Dr. Miller because he can do it.
Describe how you were before and then what you can do now. What's the comparison like?
When I first came in here, I was just very, very sore and bent over. But now I can just about do whatever I want to do.
What do you think is unique about the way Dr. Miller treats patients?
I think the most unique part about it is that he goes through a series of questions before he begins the treatment and does x-rays, so you know exactly what you're getting into before you do it.
And you like the idea of no drugs, no surgery?
Oh, yes. Yeah, very much.
Here we go.
It was really great. We've had the opportunity here on 8 West over the last couple of years to interview a lot of people like Chuck and to really have them share the story of the chronic pain, almost the debilitating conditions they had, and then moving them through the treatment. Remind people exactly what makes your treatment plan just so unique.
Well, like I said before, it's just non-invasive, and a lot of these treatment options don't work very well or last very long when it comes to back or neck pain, because it's all revolving around treating the symptom, just subsiding the pain, making the nerves not sense the pain as well to try and get relief. We're trying to take a different approach, which actually we're trying to fix the problem to help alleviate pain so that, you know, it's a more long-lasting solution and they can get back to enjoying the things they like to do in their life.
Okay, so you've got an opportunity tomorrow from 3 to 6:30 at your office, which is really nice. People can come in, again, meet your staff, see the surroundings, see your equipment that you use as part of the treatment. And then for those who can't attend, you have a special too.
Right. Call my office right now and they can schedule $39 to get their consultation and exam done, and that's a discounted price. And if it's busy, just call back because we get pretty swamped with calls.
Don't put it off. The thing I think I've heard repeated over and over and over again from every patient I've talked to, we wish we would have called sooner.
Now's time to take action and get this done.
Absolutely.
Yeah. Well, thanks, Dr. Miller, for coming in.
Thanks for having me again.
It.
Thanks.
We'll be right back.